Imagine this. A 48-year-old businessman walks into your clinic in Surulere, Lagos. He complains of frequent urination, excessive thirst, and unexplained weight loss. You check his fasting blood sugar, 11 millimoles per liter. Diagnosis? Type 2 diabetes. Now, the big question is, what is the first drug you will start? The answer is metformin. But don't just memorize it. Understand why. What happens in type 2 diabetes? In type 2 diabetes, the body still produces insulin. The problem is not lack of insulin initially. The problem is insulin resistance. The body cells are not responding properly to insulin, so sugar remains in the bloodstream. At the same time, the liver is busy producing extra glucose even when the body doesn't need it. That's why blood sugar rises. Why metformin is first line? Metformin works in 3 major ways. Number 1, it reduces glucose production in the liver. Number 2, it improves insulin sensitivity. And number 3, it slightly reduces glucose absorption from the intestine. So instead of forcing the pancreas to produce more insulin, it helps the body use insulin better. That's why it's the first-line drug worldwide. Nigerian clinical example. Let's make this practical. A newly diagnosed patient in Lasuth or a private hospital in Abuja. Fasting blood sugar, 9 to 13 millimoles per liter. HbA1c, 7 to 9%. No kidney problems. What will most doctors start? Metformin 500 milligrams once or twice daily, then gradually increased to reduce side effects. It is affordable, available in almost every pharmacy, effective, low risk of hypoglycemia. That makes it very suitable in our setting. Important side effects. Now, don't forget the side effects. The most common one, gastrointestinal upset, nausea, diarrhea, abdominal discomfort. That's why we start low and increase gradually. And very important, avoid metformin in severe kidney failure. Always check renal function. When metformin is not enough. Now, here's where many students get confused. Metformin is first line, but what if blood sugar remains high? We can add sulfonylureas like glycoside, SGLT2 inhibitors, DPP4 inhibitors, or even insulin. Especially if HbA1c is very high, the patient is symptomatic, or there are complications. Exam tip. If an exam question says, a newly diagnosed overweight patient with type 2 diabetes, what is the first-line drug? The answer is metformin, unless contraindicated. Final take-home message. Metformin is first line because it 1. Targets insulin resistance, 2. Does not usually cause weight gain, 3. Has low risk of hypoglycemia, and 4. Is affordable and accessible. But remember, drugs alone will not save the patient. Diet control, weight loss, exercise, and regular monitoring. That is what truly changes outcomes.